Andy in the attic here for a quick Q&A. Well, it's very quick because it's really just one question. Andy, what do you think about medication was the question. The context, though, is a bit specific. However, to tell you what I think about medication would be here forever. It's a huge subject, and I'm going to recommend something to you all. If you're a coach, therapist, or any kind of people helper, the reality is a huge percentage of the population these days are medicated with psychiatric medications of varying forms. And I would say the majority of people that I work with are medicated. Now, whether they are appropriately medicated or not is not really for me to decide. However, get yourself one of these, the BNF. There's I think it's the physician's desk reference, if I remember rightly, for those in the US. Other countries outside of the US or the UK, I have no idea. British National Formulary, the BNF. Now, this comes out, I reckon, about 3 or 4 times a year. To buy these new will cost you about £100, but you don't need to because it comes out so regularly. They get distributed across every hospital department in every hospital several times a year. The pharmacies tend to collect up the old editions and they get distributed amongst nursing students, medical students, and so on. You'll find lots of old copies on eBay. If you know someone who works in a hospital, ask them to go and get you a copy. Or if you live nearby, go to the hospital pharmacy and ask them for a copy. I'll probably get in trouble for recommending that little tip, but that's essentially how you can get yourself a free version. These are everywhere. In every hospital staff room, there's a copy or two of these lying around, and they're usually out of date. People always get the new ones. So British National Formulary. Now, what is it? It is an index of every prescribable drug. And within it is the class of drug it is, what it does, its effects, side effects, contraindications, drug interactions, or everything you need to know about the drugs. The psychiatric section, obviously, is quite a bulky section. It is worth learning the different categories of different categories of psychiatric drugs that people take. How do they operate? What do they do? What are the side effects? Get yourself very familiar with the terms and the conditions they use to treat. Often, of course, when it comes to psychiatry, is that they're often prescribed for people who don't have any of those particular symptoms, because many of these drugs have multiple applications outside of their original design. For example, tricyclic antidepressants, not so commonly prescribed these days because they're so dangerous in overdose. But they are often used for neurological conditions, especially that of pain control. So there's lots of other applications that they have as well. So get yourself a copy of the BNF, start familiarizing yourself with the meds. Now, what do I do differently when I have a medicated client? Nothing. It actually doesn't make any difference to what I do. I don't give any consideration at all to the medication that people have in terms of what processes or what techniques I use. Now, medication is problematic. Generally, things like the SSRIs, the antidepressants, the new class antidepressants, sure, they affect a lot of things in people, especially when it comes to creativity and things like that. But the benefit that they bring far outweighs that of the detriment that they bring. Now, there's lots of debate as to whether or not these things actually work. Are they just glorified placebo? And of course, then people put the posts up of the links to articles that demonstrate that SSRI drugs are no more effective in depression than any other placebo. And then, of course, there's plenty of counterexamples to that, and plenty of testimony from people who will say firsthand, this was not a placebo, this changed my life and saved my life. So we've got to be realistic, and I would urge coaches who like to share those news stories to stop doing it, because you have to bear in mind there are real people out there with real problems taking real medication. They don't want to be given glib references that actually it's all in their mind and they're just imagining it. They don't want to be hearing that from a coach or a mental health expert. Just worth mentioning that. Now, the SSRI drugs generally don't blunt enough of people's emotional states, cognitive states, to work with them effectively. It makes no difference in terms of what I do. However, the neuroleptic drugs, the ones that are used more for psychotic illness or organic neurological diseases, they generally will have a huge effect on cognition, memory recall, and motivations and so forth. Now, in which case, that may well give me consideration. But if I'm working with a patient who's on those medications, the chances are they have a diagnosis of a complex psychotic or psychiatric disorder. Then I'm not going to be working with them in isolation. I'll be working with them in conjunction with their psychiatrist or prescribing physician. Now, At that point, we then have to look at, are they going to stay on these medications forevermore or not? And in which case, why would it make any difference what process I use, and so on? So there's a bigger picture in terms of what we have to consider. But on an average day-to-day client presentation who's on medication, it doesn't affect what I do in terms of any considerations that I have to make. Now, within that, there is something that is worth knowing. Don't discuss, if you're a coach and you're not a prescribing physician, you're not a psychiatric professional, you're not a registered nurse, none of those things where you get involved in medication. It would be foolish to have a conversation around whether the client ought to stay on the medication or not. Simply because it's not your place, you don't prescribe, you don't have the legal standing to do so. You can get yourself in a lot of trouble. A number of years ago, I had a phone call from a local GP. The GP said, Andy, I've got a client, or I had a patient in my office this morning who said, you said they need to stop taking their medication and they should discuss it with me. And I said, actually, I can tell you for a fact I said no such thing. And the doctor said, I know, but I just thought you needed to know what the patient is saying. Now, meanwhile, that patient, who was simultaneously a client of mine, was spinning me a different story about what the doctor had said. And that's not an entirely uncommon thing if you're working with people with psychiatric conditions, or some people just manipulative. However, what I learned from that little experience was that even having a discussion about medication, even if I'm not making any particular recommendations or anything else, could be misconstrued back to the GP or psychiatrist or whoever else. And so that could be an issue, because remember, what we say, what people remember us saying, and then what people recall us saying as they repeat what they think we said, they may not actually be connected up. And so if you've had a conversation with a client around medication, then you may well find yourself being misquoted. And they may well read into something that you have said that you didn't actually intend to mean, and so on. So do I work differently with people with medication? Not necessarily. I might do. I might well, if I'm working with somebody in conjunction with their prescribing psychiatrist, have that conversation as to what is your plans in terms of medication. Is this long haul? Or once they're over the initial acute phase, are we going to see a reduction or cessation or change of the medication? Now, in which case, of course, this is the consideration I would have. So I see the patient today and they're well controlled, they're quite blunted and all the rest. There's only so much I'm going to be able to do. But if the psychiatrist tells me, okay, we're on a gradated withdrawal of that particular neuroleptic medication over the next 6 weeks, alrighty. So now I'm going to see that patient in about 4 weeks' time, and then 2 weeks after then, and then 4 weeks after that. So I can see that as the medication levels come down, the unmasking of psychiatric symptoms will be reduced. Whatever that is. The psychiatric symptoms will no longer be masked, that's what I'm trying to say, by the medication. And in which case, I need to be working with that person as symptoms re-emerge, if indeed they do at all, because sometimes they don't at all. And so that is the consideration I have. But in terms of, do I do different techniques? Nah. Do I talk about medication with my clients? Nah. Do I talk about medication with their prescribing psychiatrist? Yes, I do. And if you do get involved at that level with stuff, you need to know what you're talking about. My observation of coaches, alphabet therapists generically, is that they have an attitude about a medication. They may well have one medication which is their point of reference. They may have limited experience, if any at all, of these medications, but they're influenced by prejudicial reporting on memes and images and articles shared on social media. This is a mistake. You need to know a lot more than what people on Facebook say. And everyone on Facebook is an expert on everything from cancer to chemotherapy to medication and anti-depressants. It drove me nuts. When I was on Facebook, the amount of nonsense I saw being shared and people promulgating, and because they've seen it repeatedly, it must be true, because so many people are saying it, it's got to have something to it. And actually, a lot of these things are inherently false. So get yourself BNF, get yourself well versed in things of medication. Join some of the medical groups on Reddit. There's some very, very good groups on there where medications are discussed, user experiences are discussed when people are the recipients of these, and so forth. They are well worth looking at too. If you have any additional questions, thoughts, comments, or protestations on anything I say about medication, or if anyone has specific subjects they'd like me to talk about, stick it in the comment section, click the like button, and I'll see what I can do in a future video.